Recent breakthroughs in cancer are adding up to big bucks. Spending on cancer drugs may increase 42% to almost $100 billion through 2013. Now, those numbers are coming from a report out today from Medco Health. Bloomberg's Shannon Pettypiece is here with more. What's behind this?
Well, it's sort of good news, bad news. On the good news side, we've got all sorts of new drugs for patients either in testing or that have come on the market. But the bad news is for the people who have to pay for it, which are governments, health insurers, all of us, there's a big increase in cost associated with all these new drugs. Like take melanoma, for example. Previously, no good treatments, making it a very low-cost disease. Most patients, once it spread, there was nothing the doctor could do for them. They died in a few months. Well, now we have a new treatment for melanoma. It costs $120,000 a year, though,
wow.
And there's two more in testing behind it. Those could each cost about $100,000. So now a low-cost disease costs $300,000 a patient, let's say, if someone took all of these new drugs. So that's just one example. There's ovarian cancer, prostate cancer, a lot of breakthroughs coming at these costs. And in the U.S. alone, we'll spend $200 billion by 2020 on all the cancer drugs and the scans and the tests. It's a 75% increase, and someone has to pay for this.
I mean, it sounds like there is obviously the good news that something can be done for the patient, but how can the patient afford that? What is going to be happening with insurance rates going up, I would presume?
Insurance rates growing up, and you know, most people who have cancer are over age 65. About 18% of people over age 65 have had cancer, and they all qualify for the U.S. Medicare program.
Right.
So it's the U.S. government paying for this and the private insurers. And they increase premiums for everyone to cover the cost of the cancer patients. And in countries like the UK, they've said, hey, listen, we just can't afford this. If this treatment isn't extending life by a significant amount, we're just not going to pay for it. So some countries have actually said, you know, no, we're pushing back.
And then put that back on the patient. If you want it, you've got to pay for it?
Well, actually, in the UK, it becomes very difficult then for people to even get these drugs because
wow.
the drug companies won't even sell them in the country then. It becomes quite a problem. So all issues that we have to deal with, you know, as we talk about these breakthroughs on this show and these new drugs, the cost is something to keep in mind.
Shannon, thank you very much.